We're speaking with Dr. Michael Sherman, Senior Vice President and Chief Medical Officer at Harvard Pilgrim Heath Care. Dr. Sherman, in general, how do payers view companion diagnostic testing, and what are some of the common misconceptions or concerns?
Yes, we view it as a very exciting area and see a lot of benefit in testing for our members and for the physicians who we work with. We realize all of the waste, both cost and delay in providing the appropriate care when patients are prescribed drugs that don't work for them. And the idea of a world where we know up front which diabetics will respond to which drugs and so on for many other diseases is not only very exciting and good for the patient, but it helps eliminate cost because we're not spending money on the wrong drugs. We also view it as a little bit of the Wild West. So, for example, there are no good coding systems now, so it's hard to manage. And if a patient has a test with one physician, goes to a new physician and doesn't mention they have the test, these expensive tests could theoretically be repeated, and there would be no way to know and to do something about that. So we're all trying to understand what we can better do to address this. Our organization is looking at outside vendors that can help really serve as a partner to our physicians, and we see this less as about what's called hard denials and saying no, and more about asking them to call when they were going to order one of these tests, ask questions, and get some help understanding what's appropriate and what isn't. One of the biggest challenges for the physician out there on the front lines is keeping up with all of the changes that are happening. And we know that even for care for things like diabetes or hypertension, where everyone kind of understands what constitutes good care, about half of the right care is delivered, and study after study have shown that there's a lot of gaps in care. So when you consider that personalized medicine is an area that is changing by the month, if not by the week, there's the opportunity to miss things, either to miss the opportunity to prescribe tests or to prescribe tests and not use the information correctly. So we think by bringing in some additional expertise and making it available to the physicians we work with, that it's the right thing for them and the right thing for our patients.